Imagine sitting in a quiet, sterile doctor's office, waiting for what you hope will be routine news. Then, in a moment that seems to stretch forever, you hear the words, "If only we'd caught this earlier." A phrase like this feels like a tidal wave of regret and fear, turning everything you thought you knew upside down. It's a moment no one wants to face, a devastating reality that could have been avoided if only the signs had been recognized in time. Each day, countless people around the world hear similar news, and with it comes a flood of what-ifs, as families are left wishing they had seen the warning signs sooner. Stomach cancer, often referred to as the silent killer, earns its name for good reason. Over 1 million people worldwide are diagnosed every year, but a staggering 80% of those cases are detected far too late. These aren't just statistics. They're individuals, mothers, fathers, brothers, sisters, and friends, each with their own stories, abruptly confronted by a fight for survival. Yet, amid the heartbreak, there is hope. The body, intricate and intuitive, sends us subtle signals when something isn't right. Recognizing those signals and acting on them can make all the difference. Understanding stomach cancer begins with knowing what it is. It's a type of cancer that originates in the lining of the stomach, often developing gradually over the course of many years. It starts so quietly that most people don't even realize it's there until the symptoms become too big to ignore. By that point, the cancer has often spread, making it much harder to treat. This is why early detection is absolutely critical. The sooner it's caught, the greater the chance of successful treatment and recovery. A number of factors can increase the risk of developing stomach cancer. One of the most significant is an infection caused by Helicobacter pylori, a bacteria that can lead to chronic inflammation of the stomach lining. Other factors include dietary habits, like consuming a lot of salty, pickled, or processed foods, which can irritate the stomach and create conditions that allow cancer to thrive. Smoking, excessive alcohol consumption, a family history of stomach cancer, and chronic conditions like gastritis or ulcers can also elevate risk levels significantly. The challenge lies in the fact that early-stage stomach cancer doesn't always announce itself loudly. The symptoms it produces are often vague, subtle, and easy to mistake for something else. Many people chalk up early signs to stress, indigestion, or other everyday health issues. It's precisely this tendency to dismiss early warnings that makes stomach cancer so deadly. But paying attention to your body and recognizing when something feels off could be life-saving. Take, for example, the feeling of getting full too quickly during meals. You might sit down to enjoy a dish you've been looking forward to, only to find that after a few bites, you're done. Not because you're satisfied, but because something feels wrong. This sensation, known as early satiety, can be caused by tumors or abnormal growths in the stomach that physically reduce its capacity or obstruct the digestive tract. Over time, this symptom can lead to nutritional deficiencies and weight loss, slowly wearing the body down. It's easy to dismiss as temporary or tied to stress, but when this feeling persists, it's critical to take action. Your body is trying to tell you something, and it's essential to listen. Another easily overlooked symptom is persistent fatigue. It's something most people brush off as part of a busy lifestyle or lack of sleep. But this kind of tiredness is different. It's unrelenting, affecting every aspect of your day. When the stomach tumors bleed, even slightly but consistently, it can lead to internal blood loss. Over time, this causes anemia, a condition where the body doesn't have enough healthy, red blood cells to carry oxygen efficiently. Without adequate oxygen, basic tasks can feel exhausting. You might notice that climbing a flight of stairs leaves you breathless, or that your skin looks paler than usual. Perhaps no matter how much rest you get, you still feel weak and drained. These aren't just signs of a demanding week. They're signals that something deeper is happening. A simple blood test can reveal anemia, and point toward the need for further investigation. Nausea and vomiting are common enough experiences that many people don't think twice about them. Maybe it's a bad meal, a virus, or even stress. But what if the feeling lingers? What if the nausea won't go away, or episodes of vomiting start happening more frequently? Tumors in the stomach can disrupt the normal digestion process, irritating the stomach lining or blocking the passage of food. This leads to ongoing nausea that doesn't respond to typical remedies and can ultimately leave the body malnourished and weak. Ignoring this symptom or relying on over-the-counter medications to manage it can delay a proper diagnosis. Persistent nausea is never just a bug if it continues without an obvious cause. Stomach pain and bloating are another set of symptoms that most people dismiss. Maybe it's something you ate, or maybe it's a bit of gas. After all, we've all experienced occasional discomfort in the digestive system, but persistent, unexplained stomach pain or bloating that doesn't improve with dietary changes or antacids could be a sign of something much more serious. Tumors can create blockages in the stomach, preventing food from moving through as it should, or they can cause inflammation that disrupts the delicate balance of stomach acid. This isn't the kind of discomfort that fades after a day or two. It's a gnawing, constant sensation that demands attention. Then there's the unexpected and often misunderstood symptom of unexplained weight loss. For many, losing weight without trying might seem like a welcome surprise, but it's one of the clearest red flags the body can offer. When tumors interfere with digestion and nutrient absorption, the body begins to lose weight even if you're eating the same amount of food. Add to this a reduced appetite caused by bloating, nausea, or discomfort after eating, and the weight loss can become rapid and noticeable. This isn't a sign to celebrate, it's a sign to investigate. Perhaps one of the most alarming signals the body can send is the appearance of blood in stool or vomit. Bright red blood or dark tar-like stool can indicate internal bleeding, often caused by tumors in the stomach. It's a frightening sight, but it's also an unmistakable call to action. Blood in vomit or stool is never normal, and seeking immediate medical evaluation is critical. Tests like an endoscopy or imaging can determine the source of the bleeding and provide an opportunity for early diagnosis. Swollen lymph nodes are another often overlooked clue. These small lumps, which may appear around the neck or collarbone, can sometimes signal that stomach cancer has spread. Unlike lymph node swelling caused by infections, these lumps are typically painless and persistent, gradually growing over time. It's easy to dismiss them if they don't hurt, but they're worth paying attention to, especially if they don't shrink or disappear. Lastly, the sensation of persistent heartburn or a burning feeling in the upper stomach can be more than just a reaction to spicy food or overeating. Chronic inflammation in the stomach lining can mimic the symptoms of acid reflux, but when these sensations persist, despite lifestyle changes or medications, it's a sign that something may be wrong. Self-medicating with antacids might mask the symptoms temporarily, but it doesn't address the root cause. Each of these symptoms is a potential clue, a way for your body to signal that it needs attention. None of them should be ignored or brushed aside. Early detection of stomach cancer isn't just about improving odds, it's about saving lives. If you or someone you know is experiencing any of these signs, don't wait. Consult a healthcare professional, explain what you're noticing, and prioritize further testing if needed. Listening to your body and acting on its signals could mean the difference between a manageable condition and a far more difficult battle. Stay vigilant and always take your health seriously. Recognizing the signs early is your best defense. The journey of understanding stomach cancer doesn't end with identifying the signs. Each symptom is a piece of a larger puzzle, and piecing them together can mean catching this silent disease before it progresses. Early detection saves lives, yet far too many people dismiss or ignore symptoms that could lead to life-saving diagnoses. Let's continue to explore how your body might be trying to communicate with you and why taking action can make all the difference. When we think about weight loss, society often frames it as a positive outcome, something to celebrate. But what happens when those pounds slip away without effort, without explanation? This kind of unintended weight loss isn't just unusual, it's alarming. Stomach cancer often interferes with your body's ability to digest and absorb nutrients, leading to rapid weight loss even if you're eating normally. Tumors can create blockages or disrupt the stomach's natural processes, making it difficult for your body to break down food or draw the energy it needs. Combined with a loss of appetite due to persistent nausea or bloating, this results in a downward spiral where your body begins to waste away. The problem with unexplained weight loss is how easily it can be overlooked. People might brush it off as stress or a busy lifestyle, never realizing it could be a sign of something much more serious. If you find yourself dropping weight without trying, especially if it's more than 10% of your body weight in a short period, don't ignore it. Talk to a doctor, explain the change, and allow them to investigate further. It's always better to uncover a benign cause than to miss an opportunity for early intervention. Another symptom that demands immediate attention is the presence of blood in your stool or vomit. Seeing blood, whether it's bright red or dark and tarry, is a visceral reminder that something isn't right. Tumors in the stomach can bleed, and this blood often finds its way into the digestive system. Depending on the location of the bleeding, it might appear as vomit resembling coffee grounds or stools that are dark and sticky. These signs are your body's way of waving a red flag, literally. While blood in stool or vomit can sometimes result from less serious conditions like ulcers or hemorrhoids, it's not something to take lightly. Seeking medical attention immediately is crucial. The sooner the source of the bleeding is identified, the better your chances of addressing it effectively. Swollen lymph nodes are another symptom that often goes unnoticed because they don't always cause discomfort. These small, painless lumps may appear around the neck, collarbone, or near the stomach. While lymph nodes commonly swell in response to infections, persistent swelling without an obvious cause can indicate something more serious, like the spread of stomach cancer. Unlike infection-related swelling, which usually resolves on its own, cancerous lymph nodes remain enlarged and may grow over time. It's easy to ignore these lumps if they aren't causing pain, but ignoring them could mean missing an important early warning. A doctor's evaluation, including imaging tests or a biopsy, can determine whether the swelling is a sign of cancer or another condition. Heartburn is something many people experience occasionally. Maybe it's from a rich meal or a bit too much spice, and it usually subsides with a simple antacid. But when heartburn becomes a constant companion, when that burning sensation in your chest or upper stomach lingers despite medication or lifestyle changes, it could be a sign of something more serious. Chronic inflammation of the stomach lining can mimic acid reflux, but persistent symptoms, especially when accompanied by weight loss or fatigue, warrant further investigation. Antacids might provide temporary relief, but they won't address the root cause. If heartburn persists, it's time to see a doctor for a comprehensive evaluation. An endoscopy or imaging can help uncover whether something deeper, like a tumor, might be causing the problem. The body is remarkably good at sending signals, but it's also skilled at adapting to discomfort. Over time, people often learn to live with symptoms, normalizing what should never feel normal. This is why stomach cancer remains such a stealthy adversary. It thrives in the shadows, hidden behind the body's ability to cope. But being proactive, staying vigilant, and recognizing when something isn't right can turn the tide. Preventing stomach cancer begins with small, actionable choices. Your diet, for instance, plays a significant role in protecting your stomach lining. Focus on whole, unprocessed foods like fresh fruits, vegetables, and whole grains, which are packed with antioxidants and nutrients that help repair and protect cells. On the flip side, limiting your intake of smoked, pickled, and highly processed foods can reduce your exposure to carcinogenic compounds often found in these items. Salt-heavy diets and preserved foods are known contributors to stomach cancer, so taking steps to reduce these in your meals can have a meaningful impact. Lifestyle habits also matter. Smoking is a well-known risk factor for many cancers, and stomach cancer is no exception. Tobacco damages the stomach's delicate cells and increases the risk of cancerous changes. Similarly, excessive alcohol consumption can irritate and erode the stomach lining over time, creating an environment conducive to cancer development. Quitting smoking and moderating alcohol intake aren't just good for your stomach, they're steps toward overall better health. For those with higher risk factors, like a family history of stomach cancer, chronic gastritis, or an H. pylori infection, early screening is essential. Medical advancements have made it easier than ever to detect stomach cancer in its early stages. Procedures like endoscopy allow doctors to examine the stomach lining directly, while biopsies and imaging tests can identify abnormalities or tumors that might otherwise go unnoticed. Regular checkups and screenings are powerful tools, especially for individuals who are already predisposed to the disease. Stress, too, plays a role in your stomach's health. While it doesn't directly cause cancer, chronic stress can exacerbate conditions like gastritis or ulcers, which are known risk factors. Practicing mindfulness, engaging in relaxation techniques like yoga, and finding ways to manage stress can help support your digestive health and strengthen your immune system. If you or a loved one has been diagnosed with stomach cancer, remember that you're not alone. Modern medicine offers a range of treatments, and the earlier the cancer is detected, the more options you'll have. Specialized medical professionals, such as gastroenterologists and oncologists, can guide you through diagnosis and treatment, providing a roadmap for what lies ahead. Support groups can also be an invaluable resource, connecting you with others who understand the journey and can offer empathy, encouragement, and shared experiences. The key to navigating stomach cancer, whether through prevention, early detection, or treatment, is awareness. Recognizing the early signs, such as persistent fatigue, unexplained weight loss, or recurring nausea, is the first step in taking control of your health. These symptoms aren't inconveniences to be brushed aside. They're your body's way of saying, pay attention. In the end, listening to your body is one of the most powerful tools you have. It's easy to dismiss minor symptoms, but when something feels off, don't wait. Reach out to a healthcare professional, describe what you're experiencing, and don't shy away from asking for tests or second opinions. Staying proactive isn't about living in fear. It's about empowering yourself to make informed decisions that could save your life. By taking small but meaningful steps, adjusting your diet, quitting harmful habits, staying active, and prioritizing regular medical checkups, you're not just protecting yourself from stomach cancer, you're investing in your future health. And if any of the warning signs resonate with you or someone you care about, take action today. Share what you've learned, because awareness has a ripple effect. The knowledge you pass on could be the key to saving a life. Ultimately, your health is in your hands. Stay informed, stay vigilant, and trust in the power of early detection. In doing so, you can face the future with confidence, knowing you've done everything possible to safeguard your well-being.